Good morning and warm welcome to all. नमस्कार आणि सुप्रभात. आज आपला केएम हॉस्पिटलच्या 96वा फाउंडेशन डे आहे आणि आपला हे प्रोग्राम आपल्याला ऑनलाईन करायला लागते, पण आता मागच्या 2 वर्षापासून आपण हे ऑनलाईन एवढं शिकलो आहे की हे ऑनलाईन प्रोग्राम पण आपला खूप सक्सेसफुल जातो. नाउ I have been associated with this since 1979, this institute. So I entered as a medical student and finally ended up as HOD neurology since over last 42 years of my journey. And now since 1st January, I have taken up as a dean of this institute. But my emotional attachment starts with this even 1969 onwards, where I used to hold my father's hand and come for all cultural events of KEM Hospital. And since then, I had a dream that sometime I will achieve and I will enter this institute. But never in my dream I thought that I will head this institute. It was a tough decision for me to leave my clinical practice, my epilepsy work, and take up this admin position. But I had some vision for this, my alma mater. I am a strong believer of Swami Vivekananda, as my father was, and I believe serve Jiva as Shiva. With that motto, I took up this noble profession. And after taking up this noble profession, I've always been so happy at my conscience, at my heart, that I am doing something for the patients. So now to coming over to what my mission is for this institute. Our hospital is based on the 5 pillars. It is not by the building made by the British. It is by the pillars, that is students, residents, the faculties, our ancillary staff, that is our admin staff, our paricharika, other labor staff, and the most important and the last is the patients. हे 5 पिलर्सवर आपण थांबले आहे आणि त्यांच्या खांद्यावर बसून आपण इकडपर्यंत पोहोचले आहे. What KEM has achieved today is because of this strength and hard work of these 5 pillars. So let me just take one by one each pillar, what I plan to do for them. So the first is the students. In our time, we used to have students mainly coming from Bombay, but now we have from all over India. Also, we know that competition has increased so much. There is tremendous stress academically. Also, they come to a new city, new environment, and they have to do all this alone, away from their family, not having the tender care and love of parents. Also study to a new syllabus and excel into that. So I'm sure all of them require a lot of support, guidance, and care, and also a mental strength they have to build up. So I plan to start a student Dosti program, which includes, it should have a counselor, a psychiatrist, a medical social worker, and a teacher or a guide. It is not only for the students who have adjustment problem, anxiety, or depression, but it is also for the students who want to excel into they want to present in international level, represent at state level our hospital. They want to do research. They also need a guidance. So with this, their overall development should be taken care of. So if we have some cell like this, where the students can approach us and any of us can guide them to a proper, because I see many students coming from 2nd, 3rd MBBS, they want to do some research, they come on our busy OPD. We don't have time. We say, okay, you find a topic, we will help you. But it doesn't work like that. So I think if we have a student Dosti program, which not only takes care of their mental health, their physical health, but also their overall development. So I'm sure I will have lots of suggestions regarding this from all the faculty, and I welcome all of them. Second is the residents. Now I have been a part of this as a student, as a resident, as a faculty, and now as a dean. And I have taken part in the strikes as a student also, as a resident also and as a faculty also. So I know what problems residents have, especially my super specialty residents. All of them are married when they come here and there is no good hostel facilities. So I don't promise that I'll give you a hostel facility which is state of art. It is not so easy. But definitely I want to plan two committees. One is a student resident hostel committee, so that at least basic hygiene is taken care of, a basic necessary infrastructure is provided to you. Second most important thing which we all face is the security problem. Anytime, anywhere we are hurt, and that's the time we go on a strike. So I don't want to dig a well when there is a fire, but I want to take a preventive step so that there is no fire. So I want to have another meeting, committee of resident security committee. Now, it's very important that we have the meetings monthly or bi-monthly regularly so that no untoward incident happened, and not only when the incident happens. So this is what I want to make sure. Warden, security staff, and the guide and the teacher will be part of this committee. And after this, the third most important our pillar is our doctors. We know that all of us are doing state-of-art work, phenomenal work in our own departments. But do we know about it? Do the public knows about it? I remember the second day of my deanship, Dr. Akash Shukla came with his team and he narrated me what all things they are doing. I was so surprised and happy, but I was not knowing it. So I think what we need to plan is, I want that all departments should come and tell us what specialized thing which they are doing. And I also want that they start a specialty clinics. I will try my level best to provide infrastructure for those specialty clinics, whatever is in my capacity. But after that, we must publicize ourselves. We must feel our presence felt on the social media. I want to start a digital team or IT team which makes a Facebook page, makes an Instagram page of KEM. It also has a newspaper and radio where we should tell not only Mumbai, Maharashtra, but all over India and all over world what we are doing here. And we are doing it such phenomenal work at a nominal rate with optimal quality. I think this has to be highlighted. So I want that we must have a social media felt and we must increase our presence on that. So that is, and for that, I require everybody's support. And then I think the most important pillar of our is आपला कर्मचारी का, आपला ancestry staff, आपला इतर स्टाफ ज्यांच्या तुमच्या सपोर्ट नसेल तर हे आपण केएम आज एवढे इकडे पोहोचेल नाही. आम्ही पेशंटला बघतो पण पेशंटच्या फूड, पेशंटच्या केअर हे सगळं तुमच्या खांद्यावर आहे. तर मला एक मोटिवेशनल अवॉर्ड तुमच्यासाठी चालू करायचे, एम्प्लॉई ऑफ द मंथ अवॉर्ड, नॉट द इयर. वी आर गिव्हिंग इयरली अवॉर्ड इन दिस एन्युअल डे, बट दॅट इज बिंग फॉरगॉटन. सो आय वॉन्ट एम्प्लॉई ऑफ द मंथ in each section of the employee, and that I want to make 2 notice board where they will be given, their photographs will be put, what work they have done that will be put up, and at the same time they will be given appreciation certificate. I might try to arrange for some perk, but I cannot promise. But तुमच्या हे notice board वर तुमचा फोटो लावेल, तुम्हाला सर्टिफिकेट देणार, आणि प्रत्येक महिन्याला हे 4 ग्रुप मधून एका माणसाला बेस्ट एम्प्लॉई ऑफ द मंथ अवॉर्ड मिळेल. सर, हे अवॉर्ड मिळण्यासाठी आपल्याला सगळ्याला खूप चांगलं काम करायचं, आणि हेच तुम्हाला सगळ्यांच्या माझी विनंती, आपण सहकार्याने आणि संगती मिळून टीम वर्क करून हे कार्य पूर्ण पाडू आणि केएम ला पुढे घेऊन जाऊ. आणि आता जे नेक्स्ट व्हॉट I plan is that anything which we do, any company which we run, any institute which we run, we have to have an audit of our program, audit of our institute to know where we stand, what we are doing, and whether what needs to improve. So I want to start a patient feedback program. See, our patients are not well educated, so giving them a form and putting that form in the box doesn't make a difference. So what I want, I will form a team of members who will go randomly ask the patients for their feedback, which may be for the food, for the nursing, for the labor staff, for the doctors and the facilities. See, please don't misunderstand. This is not to penalize anyone. आज तुमच्या ओपीडी मध्ये अरे आज मॅडमचं हे टीम आले, आज आपल्याला मॅडम हे सांगणार ते सांगणार, that is not my aim. I want whenever there is a good feedback, I am going to put it on the social media. I am going to make sure that you are well appreciated by the patients and the whole hospital. Also the Mumbai and up to our admin staff and up to higher authority people should know what good work we are doing. But if there is a bad feedback, let us improve on that. We can have a meeting and see where we are lacking and what we are failing at, and definitely try and improve. Because audit is the one which makes you improve day by day. Now, all above programs, I cannot achieve alone. Maybe 20% is by me, 25% is by, but 70% आपला सगळ्यांचं सहकार्याने होणार आहे. And we have shown in this last 2 years, अगर हम सब साथ हैं, so we can achieve anything. The COVID pandemic, we have fought nails and together, and the KEM has come out as one of the best institute to treat COVID patients. So if we can achieve this, definitely we can achieve the goals which I have set for some. Definitely I need a clean KEM with good parking facilities. All these are there, but apart from this, there are these few things which I thought yesterday, and I wish to put them in action as soon as all of you give me your suggestions and we go further. So with this, I just say that I need support from all of you, from students, residents, from faculties, my colleagues, and also from the admin staff, परिचारिका आणि इतर स्टाफ सगळ्यांचं मिळून आपण KEM ला पुढे घेऊन जाऊ आणि एक नवीन KEM चा एक स्थान आपल्याला, आपण प्रीमियर इन्स्टिट्यूट आहात पण आपल्याला पुढे जाऊन अजून फर्स्ट यायचं आहे कंट्री मध्ये, त्याच्यासाठी आपण सगळं मिळून कार्य करू. अँड दॅट्स ऑल आय वॉन्ट टू से. थँक्यू आणि धन्यवाद.